Good morning, Mr. Wharton.
Good morning.
My name is Michelle. I'm a nurse practitioner student at Maryville University. I'm going to be doing your physical exam today, but first I'm going to go over some questions with you.
Okay.
What brings you here today?
I've got a sore throat.
When did this start?
4 or 5 days ago.
Is it constant? Does it come and go?
It's pretty constant, yeah. It doesn't really go away.
What does the pain feel like?
It's kind of a dry, sore, just a dry sore throat.
On a scale of 1 to 10, with discomfort and pain, on a scale of 1, 1 being just a little bit of pain, 10 being really intense, the most pain you can imagine having, what number would you rate that?
Right at a 5, but an increasing 5.
Does your pain seem worse at certain times of the day?
When I first wake up in the morning is when it's the worst.
Does anything seem to make it feel better? Cough drops, ibuprofen?
I've tried some cough drops. That's all I've tried. And it helps a little bit, but not much.
Does anything seem to make it feel more sore?
High levels of activity, working out or running.
Does it hurt to swallow?
There's some discomfort, but it doesn't hurt worse when I swallow or anything.
Okay. Have you been around anybody that's been sick?
Not that I'm aware of.
Do you have any other symptoms? Fever, chills, cough,
Just
headache?
a sore throat.
Just a sore throat. Do you have any drainage? Feel any drainage when you're swallowing?
No.
Okay, I'm going to go over your medical history with you. Have you had any childhood illnesses? Chicken pox, rheumatic fever, scarlet fever?
Just the chicken pox.
Have you ever been diagnosed with tuberculosis?
No.
High blood pressure?
No.
Heart disease?
No.
Stroke?
Nope.
Asthma?
No.
Recent bronchitis, upper respiratory infection?
No.
Have you ever had a pneumonia?
When I was younger, 7 or 8, but that was it.
Have you ever been diagnosed with sleep apnea?
No.
Any kidney or bladder problems?
Nope.
Ever been diagnosed with hepatitis?
No.
HIV?
Nope.
Have you ever been hospitalized for anything other than a surgical procedure?
No.
Have you had any surgeries?
Tubes put in my ears when I was little, that was it.
You did okay with the medication
Yeah.
that they gave you for that surgery? No reactions?
No.
Do you take any medications, including prescription, over-the-counter, herbal remedies?
Over the counter, just seasonal allergy medication.
Do you take that every day, all the time?
Starting
consistently?
in early spring, I'll try to take it just to keep from getting allergies.
Okay.
So.
Do you have any allergies to any medications?
No. Augmentin.
Okay, what kind of reaction do you have?
Just a rash.
Do you have any environmental or food allergies?
No, it's some pet and animal dangers, outside, pollen, but nothing significant.
Now we're going to talk about your family history. This includes your parents, siblings, grandparents, aunts, and uncles.
Okay.
Does anybody in your family have heart disease?
My grandpa had a heart attack about 3-4 years ago, had surgery for it, and he's doing better.
He's doing okay. High blood pressure?
Not that I'm aware of.
Cancer?
My other grandpa had cancer the last 10 or 15 years of his life. I think it was bladder cancer.
Did he smoke?
He smoked early in his life, yes.
Tuberculosis?
No.
Stroke?
No strokes.
Seizure disorders?
No seizures.
Diabetes?
My grandma had diabetes the last 10 years of her life.
Kidney problems?
Not that
kidney issues?
I'm aware of.
Thyroid disease?
Nope.
Any bleeding disorders?
I don't think so.
Has anybody ever had a blood clot?
No.
Any allergic conditions? They have to carry around an EpiPen?
No.
Okay. Now I'm going to ask you some questions about your personal history and your social life. What do you do? What kind of job?
I'm an office manager. Sit around and do office work, computer work, paperwork.
Do you enjoy your job?
Yes.
Okay. Are you married?
I'm happily married.
Happily married. Do you have any children?
No kids.
No kids. Do you take care of any family members?
No.
Okay. Do you have any hobbies or interests?
Hunting and fishing, some pickup sports. That's it.
That sounds nice. Do you have a lot of stress or strain in your life?
No, not really.
Are you able to sleep okay at night?
I sleep well, yes.
How's your diet? Are you?
It's pretty healthy. I'm sure I eat too much sometimes, but nothing crazy.
Do you drink any caffeine, tea, cola, energy drinks?
We don't keep it around the house. Maybe coffee if we go out for breakfast, something like that.
Do you drink any alcohol?
Maybe 2-3 times a month. Go out for a drink on a weekend night. 3 or 4 beers.
Beer. Okay. Do you smoke tobacco or chew any tobacco products?
No tobacco use.
Any street drug use?
No.
Have you traveled anywhere recently?
Got to go to the Dominican Republic this winter for a week, so that was fun.
That sounds really nice.
Mm-hmm.
All right. Well, thank you for answering those questions for me. We'll continue with our exam.